Franz, what is going on in interpreting research in 2013? What are the most important topics, and what have been the most important gains that you've got through research in recent years?
From my point of view, a lot is going on, a lot has been going on, and really we see lots of dynamic developments in the field. In terms of hot topics, what is out there as a focal point in research, I guess we'd have to decide hot for whom, of special interest for whom, because the field has expanded so widely that community-based interpreting has some hot topics, whereas conference interpreting maybe is a domain with different sorts of focal points, and again, signed language interpreting might have its own hot topics. So you can guess that in the discipline as a whole, in interpreting studies as a whole, the list of hot research topics will be quite long. But broadly speaking, something that covers, that is relevant to all of these domains would be quality. I mean, that's a classic and has been around for a long time. Quality, technology, and the professional ecology or the working conditions. And these three hot topics are broad themes. They're much broader than topics, interrelated. Just to give a few examples, in community interpreting, video remote interpreting is now a big issue, and that would raise the issue of, can quality service be provided in a remote setting, and how does it affect the working conditions of these interpreters. And it's also a nice topic because it cuts across domains. Remote interpreting is a big topic and has been a big topic also for conference interpreting, big studies being conducted at European Parliament, and now there's a flourishing scene of video remote interpreting in medical interpreting, in legal interpreting. So that's definitely a field where a lot more research needs to be done in order to find out what technology is adequate, what working conditions need to be put in place, and what kinds of quality standards can be achieved with these very often difficult working conditions. Conference interpreters have been claiming for a long time that we need full access, we need to be there, we need this feeling of presence, and now to see that so many healthcare interpreters are sitting in front of a small screen and managing interaction between people in a faraway clinic, that's quite a jump. It's quite a different world out there, and the question will be, what standards can be maintained.
What do we know so far about quality and for example, video interpreting? I mean, what studies have been conducted and what have they shown?
There have been quite a few studies comparing different modes, and the criteria would have been patient satisfaction, for instance, or interpreters and service provider satisfaction. Interpreters, it turns out, based on a survey that was done a couple of years ago with a sample of over 50 interpreters working in telephone interpreting mode and video mode, that they would consider video remote interpreting a lot more adequate for most settings than telephone interpreting only. So there have been studies from various perspectives. What would doctors prefer? What would patients prefer on what sort of mode would be more useful? And I think that there is a consensus developing that video is the preferable mode for patients as well as doctors and interpreters.
Why would anybody want that rather than having the interpreter right there with the patient?
It's a question of, different arguments. If you have a country like Australia with a large geographical, spread to be covered, or Canada, and you have very specialized languages or with limited needs, maybe you need an interpreter for language X 5 times a year, to expect that person to travel wide distances for a half a day of interpreting would not be very economical. So to look towards technology-based solutions makes sense in some of these cases. In other cases, like the London Metropolitan Police, I hear, is launching a remote interpreting hub because the city is so difficult to navigate with traffic. So it would take 1 or 2 hours for an interpreter to get to a police station to serve as an interpreter, and it would be much quicker to access an interpreter via a video conference link. So those would be a few reasons. I think most people are aware that on-site, face-to-face interpreting is still preferable, but there are many factors working against that. For instance, you might have waiting times in hospitals, whereas when the doctor is ready, pushes a button, and then it might take a minute to have the remote interpreter there. It reduces waiting times. Also for interpreters who would want to get paid for the hour that they spend in the waiting room, for instance. So there are reasons, but as practicing interpreters, we would think that being there is still our top priority, and I would agree.
So apart from video and video-mediated interpreting, what else are people looking at in the field these days?
Well, again, if we look at community interpreting, I think it will be the difference between professional and non-professional service provision. How big really is the difference? That's the question you often hear. Why isn't it okay to bring somebody, a bilingual, to come in and do consecutive interpreting of a dialogue situation? Is it really that bad? Do we really need people with lots of training? And so that difference needs to be looked at carefully in some carefully controlled comparative studies. We don't have clear answers. We can't say that if you bring your relative, it never works. It's always a disaster. There are some studies, especially in the healthcare field, where some very big gaps, have been uncovered, and errors in medical interaction. But those are usually small samples, selected cases. We need more research, more of an evidence base for that. So I think that should be looked into, because some degree of non-professional mediation of communication for immigrant populations or for the deaf community will always exist in our societies. There will always be the children of deaf adults who have the full trust of their family and who have the motivation to help their parents, let's say, who will go in there as interpreters. And we cannot claim from the beginning to say, oh, you haven't spent 2 or 3 years in training as an interpreter, you're a poor interpreter to begin with. So it's a gray area, and that's a difficult issue to look into further with more research. For conference interpreting in particular, I'm fascinated by the issue of ELF, English as a lingua franca, which could be seen as competition to simultaneous conference interpreting, or else as part of our reality, because after all, even though most delegates do use English as a lingua franca, regardless of the country and linguistic background they're coming from, there would still be some interpreting service offered, maybe bi-directional, bilingual services, let's say English-Polish if you have a conference in Warsaw. So interpreting doesn't die out with the use of English as a lingua franca, but maybe the multilingual meetings of former times are on their way out, but there's still conference interpreting. And the question sometimes is, if interpreting is still in place, can you do without interpreters? Is communication in English as a lingua franca really effective enough, or is it preferable to have high quality simultaneous interpretation? And that is one study on quality that we did in a project in Vienna, and set up an experiment on the effectiveness of interpretation, looking at quality in terms of actual comprehension by the audience, whether the interpretation gets the message across as effectively or possibly even more effectively than in a situation where the audience listens to a speaker using English as a lingua franca, claiming that anybody that understands English, people with college degrees, they would say, in my field, I can follow an English language presentation. And lo and behold, we did find that those people who would listen to high quality simultaneous interpretation into their native language did significantly better on the comprehension test. So there's still a place for quality simultaneous conference interpreting.
I know a researcher who's been trying to get a controlled environment to do just that, to follow delegates who work with interpretation in European institutions, and then to see what happens to them if they have to operate without interpretation and rely on their English skills. But it seems to be very hard to get test subjects and to get a sufficiently controlled environment to actually do that. So how did you manage?
Well, we had some grant funding, so it can't be done without money. You need mostly manpower, woman power in that case. And we then partnered with business colleges who gave us access to their advanced business students, because we needed access to their grades and English language competence proficiency levels, so as to form a large group and then randomize them for the experiment. One group would be listening to the non-native English and the other group to interpretation into German. So it took some money, not a whole lot of money, but money mainly for the staff, for people who would develop the questionnaires, develop the design and the materials, working a full 2 years to make this happen. So you can't just do it on the side on weekends and some holidays. So it was a 2-year project in collaboration with several business colleges in Vienna. I think we had a total of 240 experimental participants.
Do you know of any recent research that has served to influence the way interpreters are actually taught, or the way that interpreters work? Any findings of a, shall we say, mindset-changing nature?
I think in training, the changes would be more incremental. There's a continuous flow, I think, of research on training, focusing on specific issues, what might work, number drills, for instance, because numbers are always a problem in consecutive, but also in simultaneous, for some language combinations, for instance. But I don't see a fundamental change in the way we train interpreters. But there have been, even in previous years, some examples where research did change minds about training approaches. The famous example, as far as I'm concerned, is shadowing. For quite some time, after a phase where cognitive psychologists or people with a background in cognitive psychology had an influence in the training of conference interpreters, shadowing was considered a very useful technique to start students out in learning the skill of simultaneous listening and speaking. And there was one study done on a very small scale in Geneva under the supervision of Barbara Moser-Mercer, I believe, finding that advanced students were actually more proficient shadowers than experienced conference interpreters.
So how do you use shadowing in your own teaching after your results?
In my own teaching, for instance, I might use shadowing for, say, 5 or 10 minutes at the very beginning of simultaneous interpreting instruction to ease students into the skill of simultaneous listening and speaking, and it would soon pick that up, and we would move on to paraphrasing and then doing the real thing, interpreting between different languages, but using the right kind of startup materials. That's usually student presentations, peer stories, narrative texts, something that they can feel they have control over, they can empathize with, and that will be, I guess you would call it the natural training approach, rather than finding exercises, drills that don't, at first sight, don't have much to do with the composite skill of simultaneous interpreting.
Thank you very much.
You're welcome.